This MediSync ECG review will focus on case number 308 from ECG Wave-Maven. Copyright information is provided here. A 47-year-old woman with a history of breast cancer and a life-threatening problem, echocardiogram showed normal ventricular function and no pericardial effusion. This ECG is most consistent with which one of the following diagnoses? The answer, hypercalcemia. The clinical diagnosis was hypercalcemia due to metastatic breast cancer. The ECG shows resting sinus tachycardia with borderline left axis deviation. There's also borderline low limb lead voltage. The key finding is very short QT intervals, such that the T wave appears to take off directly from the J point with marked abbreviation of the ST segment. This finding correlates with shortening of ventricular action potentials. Elevation of the J point in leads V1 to V3 is sometimes also seen with hypercalcemia simulating ischemia. The lower limits of the absolute QT and rate-corrected QT intervals are not well defined, and relative shortening occurs physiologically at higher sinus rates. The two major pathologic causes of an acquired, relatively short QT are hypercalcemia and digitalis effect. The latter is excluded here by the absence of characteristic scooped ST depressions. A hereditary form of short QT syndrome has been described recently in families with a history of sudden cardiac death.